Thinking about getting some injectables but don't know where to start? Welcome to my series called Injectables 101. Hi, my name is Dr. Jenny Liu. I'm a board certified dermatologist and welcome back to my YouTube channel. Today, I'm going to talk about one of the most versatile and transformative injectables, and that is dermal fillers. So whether you're just curious, wanting to learn more, or is actually thinking about getting some for yourself, I'm going to break it down in today's video. The goal here is really to help demystify dermal fillers, answer some most commonly asked questions, and provide a comprehensive overview of what they are and how they work. So if that sounds good to you, I would love it if you can give this video a thumbs up. Don't forget to hit the notification button and subscribe to my channel. So what exactly are dermal fillers? So essentially dermal fillers are injectable treatments that really help to add volume and smooth out wrinkles, as well as enhance certain facial features, contour, and lift. So unlike Botox, they really target the muscles that essentially over time, these muscles, when they contract, create wrinkles that are etched into our skin from facial expression. So like the 11s when we frown repeatedly over time, or say the forehead wrinkles from lifting our eyebrows, dermal fillers really help to add volume to areas that have really essentially lost its fullness due to aging. And so dermal fillers work by restoring the lost volume, and thereby most commonly are used to treat like the deep lines on our nasolabial folds, around our mouth, as well as restore volume to our cheeks and lips. So as we age, there are several things happening with our face beyond just the collagen loss and thinning of skin. There's fat loss, muscle changes, ligament changes, as well as bone resorption. And all of this essentially leads to loss of support structure within the face, volume depletion, all leading to sagging and deepening of the folds. We also have deeper fat pads within the skin that actually will shift downward. And this basically leads to more of a deflated cheeks, leading to hollowing around the eyes, a darkening of the circles, as well as deepening of the nasolabial folds, the marionette lines people call it, as well as less defined jawline, and even some people will get a jowl or submental fullness. There's even sunken in temple, and basically not only just sagging, but more flattening of facial features and less of a smooth contour that we often associate with youthfulness, and kind of loss of that heart-shaped face for women, which is often what we try to restore as we perform these aesthetic treatments with, say, dermal fillers. So with that, dermal fillers help to add volume back or restore some of the volume lost with aging, helps to lift and contour and define. And like, for example, one of the most common ways where we inject fillers is into the cheeks, really help to smooth, add more volume and fullness to a deflated cheek. You can also add fillers into like the deeper marionette lines to soften the appearance of those deep folds, add fillers into the jawline to create more of a defined jawline. Now, when we do this, we're obviously doing it with the intent of making someone look more natural, like themselves, like their age, but just a little more refreshed. We can never make someone in their 50s or 60s look like they are in their 30s and 20s. And honestly, really don't want that, because that looks very unnatural and overfilled. And one of the most commonly asked questions or concerns I get is, I want to look like myself, but don't want to look overfilled. And that is really the goal. And I feel like that is truly the goal for anyone who's really experienced and good with what they're doing aesthetically, is really making someone look like themselves, but just more rejuvenated and refreshed. Now, fillers aren't just for rejuvenation. It certainly can be used by much younger patients who may not necessarily have those aging concerns, but want to enhance their features. For example, lips, one of the most commonly injected areas in younger patients. Individuals that have thin lips, like myself, who want more fuller lips, fillers can be injected into the lips to create volume. In the experienced person, because this is very high risk, fillers can even be injected into the nose, called like a liquid rhinoplasty, to build that nasal bridge in somebody who have like a lower bridge, to create a more of a slimmer nose. Men often will seek fillers to create a more square or chiseled jawline that gives more of a masculine look. So there are lots of different uses for dermal fillers beyond just rejuvenation or anti-aging aesthetic treatment. Now, the most common type of dermal fillers used to do those things are essentially hyaluronic acid-based fillers, and they come in different formulations, different types, essentially to help restore volume, smooth out deep wrinkles, even superficial wrinkles, or even add hydration. It just depends on the product that is used. These fillers, when injected into the skin at various depths, basically help to create the desired outcome. Now, the most common brands that we hear about, especially in the US, is Juvederm, Restylane, and Bellatero. There are a lot of other brands too that are available, and some that are not available that are commonly used in Asia. But those are the most common brands that you may hear your injector or your dermatologist mention or talk to you about. So aside from HA fillers, the other fillers that are commonly injected is called biostimulatory fillers. Essentially, these are known here in the US as Radiesse or hydroxyapatite and Sculptra, poly-L-lactic acid. Even though they're injected similarly on the face as one would with HA fillers, they differ slightly in the sense. So traditional HA fillers, you get what you see in the sense when it's injected into skin, it's there, it's instant. Aside from some swelling, but it's pretty much the result that you see. With the biostimulatory fillers, as the name implies, they won't really give you that instant gratification. Instead, they help to stimulate your skin, your body to build collagen over time, usually the period of like 3 to 6 months. But they do help with, the flattening of our facial features, helping with the deep folds, the wrinkles, and it's not like one is better than the other. And honestly, in someone who is seeking dermal fillers in general for kind of rejuvenation and improving signs of aging, the biostimulatory as well as HA fillers really complement each other in giving you a more comprehensive and better result. And the other thing too, without getting too nuanced on you guys, is that even within each brand, you have different HA fillers. Not all HA fillers are the same in the sense there are different fillers basically made for its intent of use. In the sense, you want your treatment to be customized so that way it looks natural and harmonious. For example, if you want to lift your cheek, you want something ideally that is firm, that is going to hold and lift. You don't want something that's liquidy and mushy because when you inject it, it's just going to basically melt away, right? But similarly, that product that is intended to lift, that is firm, you don't want that injected around the mouth where we animate or even into your lips because that is just going to show through as you talk. It's not going to flow out. It's going to look bumpy and look really unnatural. So even within each brand, there are different fillers that are meant to be injected into your cheeks, meant to be injected into your lips or into your jawline. And we call that G prime, essentially describing the firmness and elasticity of those fillers. And you want that because, like I said, that really allows you to have a customized approach to treat your face as a whole, to create balance and harmony, but in a natural way. And one of the most important things, like I said, and I said this before, is if you are interested in seeking out cosmetic procedures for rejuvenation or for whatever reason, really make sure that you find an injector who is experienced and whom you're comfortable with. Okay, now let's quickly talk about some of the most common areas treated with dermal fillers. Number 1, lips. Whether you're young or old, lips are one of the most common areas treated with dermal fillers. It just depends on your goal. Someone who is younger may just need a filler to help add volume to create a more fuller lip. Someone who's older, they probably have volume loss, but there's also more dryness to the lip. So here, helping to restore volume, but as well as using a filler on top of that to add some hydration may help. It just really depends on the filler that is used and your goal. But here there is Juvederm Ultra, there is Restylane Kiss, Restylane Silk, and there's a lot of great options. 2 is cheek augmentation. I would say this is probably the other very common areas, again, for rejuvenation. And often with cheek fillers, it is injected much deeper because the intent is to help lift and contour. So often it may be injected on bone or say with a cannula into the mid cheeks to help restore some of the volume lost. And in Asia, I know that dermal fillers are injected not only into the cheeks, but even into the hairline to create more of an illusion of a smaller face. So those are some of the more advanced techniques that are not as commonly done here in North America. You can use fillers, as I mentioned earlier, to really soften the nasolabial folds, the marionette lines, as well as the periorbital lines, or the smoker's lines, people call it. You can even use fillers to enhance your chin, augment the chin. If you feel like your chin is not as strong, use fillers to define the jawline, as well as tear trough. And this tear trough, the last one, can be done again in someone who's young or old. I've done it before for both. Often for the aging patient, it's because of those facial changes with age that leads to dark circles. And so often restoring the cheeks and adding a little bit to the tear trough can be helpful. But someone who's younger, who may not have the features of like a sagging aging face, sometimes it's just they have genetically dark circles, adding a little filler, light filler into the tear trough to conceal the darkness can make them look more refreshed and less tired. So what to expect when you're getting your treatment? Well, first and foremost, you should always have a consultation with your injector. And this is where an experienced injector will listen to you, understand your concerns, what bothers you, go through with you his or her plan for that treatment. And then, if you're comfortable with what they're going to do, the risks and benefits, as well as the cost, move through with it. The other thing is that when it comes to, facial rejuvenation, restoration, it's often not a one-time thing. For really nice and natural results, often it requires multiple sessions of treatment over time. And the other thing I want you to understand is often with like facial rejuvenation, especially with aging, like for example, you may be bothered by the deep lines, but you may be wondering like why your injector is talking to you about filling the cheeks. Well, this kind of goes back to the nuances of facial aging and the fillers and the technique, right? We know that the fold is created by loss of volume, and so one of the first things we want to do is to restore that volume. You don't always necessarily tackle the problem where it's at, because again, this is where we have to understand the full process and really treating the face as a whole and not just by problem area. Otherwise, this is where you will run into trouble, like filler migration, looking unnatural. Now, as far as the treatment itself, it may happen the same day or on a different day. It just depends on your injector schedule and also what you want to have done. Some filler treatments take a little bit longer than others. But say if you are actually getting the procedure, what happens next is after the consent, your face is cleansed and then prepped sterilely. We want to remove all the bacteria on the skin because we are never, injecting into your face. So we want to reduce the risk of infection. And then afterwards, usually a topical numbing cream is applied, again, to minimize the discomfort. And then one thing I forgot to mention is that there is numbing lidocaine often in the filler itself. So it does become more comfortable or less painful as the treatment goes on. Your injector will also then go ahead and mark out the areas that he or she is intended to inject and then go ahead and proceed with the injection. As far as like the technique, this is so variable. It really depends on so many things, like the product that's used, the location that's injected onto your skin, and what your end goal is, right? And so you can expect usually a combination of sharp needles, often maybe in areas or on bone, or with a longer blunt needle called a cannula. And all of this is really, the goal is to create the desired outcome and minimizing the risks and side effects. Now, for the most part, what you see is what you get. The lips can't swell pretty quickly, and often that swelling takes about 10 days to go down. But otherwise, if it's like the jawline, the temple, the cheeks, the tear trough, pretty much what you see is what you get. After the injector is done, he or she may go back in some areas and massage out any lumps or bumps, just making sure that the filler is evenly distributed. And this is often very helpful, like for example, around the lips to avoid nodules. But otherwise, you're probably advised to just like take it easy, avoid any strenuous exercise that day, avoid going out in the sun, because that may cause hyperpigmentation. And then, if you're uncomfortable, you're having a lot of discomfort, ibuprofen, NSAIDs can be helpful. Tylenol can be helpful. Icing, I find it to be tremendously helpful. But there isn't a lot that you need to watch out for. And you can certainly, if you're comfortable, continue your usual nighttime skincare routine. Otherwise, keeping it simple with just moisturizer, gentle cleansing, and sunscreen is really what you need. Now let's talk about the common risks or side effects, if you will, as I alluded to earlier. The most common, aside from discomfort and pain, is probably bruising and swelling. And as you can imagine, we're going in with needles in your face. Inevitably, there's going to be some bleeding and maybe bruising. If you don't, great. If you do, understand that that is very normal and expected. There's not a lot you can do. Icing it helps, but just give it time. Usually goes away in a week or so. You can certainly camouflage with makeup if you need. That swelling, it kind of just depends on where you've had treatment, but one of the most common areas is the lip. The lip swells pretty quickly, and that swelling usually goes away within a week. And so this is where you may actually hate your lips for the first week, but after that lip swelling dies down, you will start to really like the results that you're getting. And that is really going to be the result that you're seeing. It's usually about a week to 10 days. So that is the most common side effect. The other I would say less common, but can happen, is if a filler is injected too superficially on your skin, that almost kind of is seeing through your skin, can kind of give off this bluish hue or Tyndall effect. And then also like nodules or like reaction on the skin that may occur. Those are less common. And the good thing is that if that does occur, you can often dissolve that with hyaluronidase, which is what is used to dissolve fillers. And the other thing too is, in somebody who's maybe not as experienced, you can have some filler migration where often the filler can shift and look odd over time. And then one of the more serious complications, and I would say this is probably by far the one you want to avoid, is vascular occlusion. So what is happening here is that when fillers are injected into your skin, like I said, you have a lot of blood vessels, and a lot of blood vessels are really pretty important in the midface. Those blood vessels, if the filler gets accidentally injected into a blood vessel, it can do a couple of things. Number one, most commonly, is that that filler just stays in that blood vessel, in that location. It causes basically vascular compromise. There's no blood flow and your skin dies, and you create what is called a skin necrosis or an ulcer. Common locations include like the nasolabial fold here, the temple, and the forehead. One of the more serious and scariest side effects that, knock on wood, is pretty rare but can happen in the similar area is going blind. And that has to do with the fact that the vasculature on our face, they're all connected, particularly the vessels around our nose and the forehead area, as well as temple, is connected with the blood vessels that feed into our eyes. And if, God forbid, that filler gets injected and travels into the blood vessels and goes into your eye, the vessel goes into the vessel that feeds your eyes, you can certainly go blind temporarily, or a few cases of permanent vision loss have been reported. So this is, again, going back to why your injector may choose to inject the filler in a certain way with a particular technique, is to deliver the results but in a safer way. And again, this is also why you want to seek out an injector who is experienced and knows what they're doing. And lastly, as long as how long the hyaluronic acid fillers last, anywhere between 6 to 9 months to a year, or even 2 years. It just all depends on like how fast you break down the hyaluronic acid, because that is really how we are breaking it down. So our body's own natural enzyme in our skin is breaking those down, as well as the product that is used. Some products last a bit longer and some shorter. Now, I did not really go into depth in this video about the biostimulatory fillers like Sculptra or Radiesse. And if you want me to talk about those, please let me know in the comments below. And with those fillers, the risks are there, they're similar, but the treatment sessions are a little bit different, and usually it's a treatment plan of multiple vials done over the course of a few months to really deliver the results. And then often there needs to be like a maintenance, and same with dermal fillers as well that are hyaluronic acid based, because our body eventually do break them down over time. If you really like the results, you really want to kind of follow up with the provider that you trust, and to help to go in for maintenance, but at the same time, being mindful, not being overfilled, and still looking natural. And again, going back to what I said, someone who is experienced, who you're comfortable with, who you like the results of their work, that is the person that you should be seeing. Let me know if you have any questions below regarding fillers in general, or any other aesthetic topics that you want me to tackle next. Thank you guys so much for watching, and I will see you next time.